And so we actually need to carry out public health sensitization, or the sensitization of the public on how to prevent malaria. Not to waste much time, I just want us to now look at the best way of treating malaria. We treat malaria using a number of drugs. There are those drugs that clear the erythrocytic stage of plasmodium. There are few that have been known to treat the senescent stage, but none has been known to clear the sporozoites and the gametocytes. So the classification of antimalarials is in accordance with the action against the different stages, where we have one. The first class is tissue senescenticides. These are drugs that eliminate developing tissue senescence in silent states, which we call as hypnozoites. Even those that are in active states dividing, like the tissue senescence, these can be cleared by primaquine. It is known that primaquine, when you use it, it can help to clear that. Then we also have blood senescenticides, which are drugs that act on blood senescence, and they form most of the drugs that we use in common treatment of malaria. These include chloroquine, amodiaquine, artemisinin, pyrimethamine, mefloquine, quinine, and so forth. All these drugs you see commonly used for treatment of malaria are just very effective in clearing the plasmodium that is circulating in blood. So they cannot affect the gametocytes, they cannot even treat the sporozoid, they cannot clear the sporozoid from the gut, neither can they clear some of the liver stages until the drug comes in. Originally, we have the first class of blood senescenticides being chloroquine. Chloroquine used to be the best drug, and it still stands to be the best drug for treatment of malaria because it is very aggressive. It clears malaria to zero level, where it will clear it completely without leaving some kind of parasites at the mercy of the immunity of the patient. But some of the drugs have, submaximal clearance, where they may leave one or two, with the exception of a few that have very good clearance. So the effectiveness of a drug for curing malaria is measured according to the degree of clearance of plasmodium from the blood plasma, and that has been well observed with chloroquine. Unfortunately, chloroquine has been found to be resisted. Chloroquine has been found to be resisted by P. falciparum. That causes complicated malaria. But the chloroquine is a potent senescenticide. It is active against the erythrocytic form of all the 4 species of plasmodium. It does not have any effect on sporocytes or hypnozoites or even gametocytes. However, the mechanism of action